So this child presented with the abnormal head shape. An important tip for you is that whenever you approach a child with abnormal shape of head, try to look it from the top and from the sides. So you will get a good overview of skull shape. So from looking on the top and from the side, an obvious deformity is seen here. The skull has greater diameter in the AP direction as compared to the lateral direction. So skull is abnormally elongated, abnormally increased in length, and the diameter on the side to side is reduced. So most likely this is a case of the craniosynostosis, and most likely suture involved is the sagittal suture. For confirmation of our diagnosis and going for the surgery, we need to have a radiological image in the form of 3D reconstructed CT scan, in which we will see that which suture are open and which sutures are closed that we are going to operate. So 3D CT scan was performed in this index case. CT images of the index case, you see very well here that these images shown in the on the lower side. There are two type of images shown here. These are basically the bone windows, because bone is clearly visualized here. Brain parenchyma is not properly visualized here, so we call this as a bone window. Fracture are well seen on these images. On the other hand, the images shown on the lower side, these are called basically 3D constructed images of CT brain. So important finding here is, if you see these areas, there are gapping areas in the skull bone. These are gap in skull bone. This is gap in skull bone. These are the gap in skull bone. These are the gap in skull bone. These are the gaps in skull bone. So these gaps where two bones are uniting, these are called as suture. So these are the different suture line. So let's mark these sutures. If This one is the cornal suture, because it is separating the frontal and parietal bone. This one is the uh, lambdoid suture. It is separating the occipital bone from the parietal bone. This one is squamous suture, that is separating the parietal bone from the squamous part of the temporal bone, petrous parts, temporal bone. So these are the three different sutures. Now, in next image, if you see here, the lambdoid suture is visualized here, posterior part. Now, a very important finding here is that if you see here, or if you see here, a ridge is seen. Normally, this is the location of the sagittal suture. So in this case, child is not having a suture line. Instead, bone is fused and a ridge is made. So this is basically the premature fusion of the two bones, which we call as craniosynostosis. If I zoom it, then you can well see this images, that this one is the important finding here. So this in this area, these are basically the important finding here, is that normally suture looks like this area, but if it is fused, then it will appear like this. So there is abnormal fusion and premature fusion of the sutures here. So this one is important finding. Let's move to next image. Again, here you can well see that this one is the interiorly, this suture is called as metopic suture, and this one is the interior fontanella. So metopic suture is not closed, interior fontanella is patent here. Next, this again, in this you can well visualize that child is having normal metopic suture, normal uh, corner suture, normal squamous suture, but abnormally closed sagittal suture. So abnormal closure of sagittal suture will cause the skull to grow interior posteriorly. There will be no growth of skull in the lateral direction. So skull will be the skull diameter of skull will be more increased on the AP direction. So this will be typical of Scaphocephaly, that is also called as boat shaped skull. Thank you.